The current conflict in Syria has resulted in the worst humanitarian crisis in the 21st century. According to the United Nations, by the end of 2013, 9 million Syrians were in need of assistance. More than 130,000 have been killed, and over 2 million refugees have fled violence, torture, and rape to neighboring countries. International medical and humanitarian organizations have been denied access to the affected neighborhoods to provide aid to civilians on the ground. Due to the indiscriminate bombing, many injured civilians have lost their lives because of bleeding and lack of access to medical care. More than 500 healthcare workers have been tortured, imprisoned, and killed, including Syrian Arab Red Crescent volunteers and staff. There are significant shortages not only of medical supplies and personnel, but also of basic resources such as fuel to operate hospital generators. From August 2012 until January 2014, SAM's physicians have successfully conducted 13 training courses close to the Turkish-Syrian borders. SAMS has also been providing medical supplies, fuel, and ambulances inside Syria. In 2013, SAMS shipped more than 24 containers with medical supplies and equipment, established 4 warehouses inside Syria, in addition to warehouses in Jordan and Turkey, with on-site warehouse managers and a biomedical engineer to check the readiness of the equipment. SAMS has established 25 field hospitals and is supporting 65 trauma care facilities across Syria. Civilians and children now depend on organizations like SAMS to provide basic medical care, emergency treatments, and life-saving surgeries. The ongoing initiative, Save Syrian Lives campaign, has allowed SAMS to become a leading organization to provide medical relief to injured Syrians. The campaign initially sent medical missions to treat the Syrian refugees in Turkey and Jordan, and then later trained hundreds of Syrian doctors and paramedics on basic and advanced life support. In 2013, SAM's campaign helped treat over 80,000 patients and performed over 31,000 surgeries. SAMS has also been working on public health projects. Due to the outbreak of polio in 2013 and lack of access of international organizations to northern Syria, SAMS, along with 7 other organizations on the ground, formed the Polio Control Task Force to perform cross-borders vaccinations in coordination with the local councils. The Turkish Red Crescent provided 2.5 million doses of the vaccine. The first round of house-to-house polio vaccination campaign in northern Syria was conducted by 8,500 volunteers from January 2nd to January 11th, 2014. It reached about 1.25 million out of 1.4 million targeted children. Multiple SAMS medical subspecialty groups have been established, such as critical care, nephrology, and ophthalmology, to provide consultations, monitoring, and field visits inside Syria. SAMS has established 3 mobile clinics to provide primary care services to nearly 60 villages inside Syria. SAMS also sponsored 2 maternal care centers and provided specialized psychological care for patients and children who were affected by the violence. SAMS established the psychosocial support team in Jordan and recently expanded to areas in Damascus. The team provides varieties of activities to the refugees and displaced people that include individual and group therapies, schools and camp visits, children activities, and treating patients with mental illness. SAMS is proud to be recognized by the United States and other countries as a leading medical relief organization. SAMS is constantly advocating for more humanitarian aid and collaborating with other international relief organizations to alleviate the ongoing medical crisis. SAMS has grown from a staff of 1 employee in 2011 to 50 employees in 2014 in 5 different countries. The medical relief project that saved thousands of lives came to light by the hard work of the SAMS staff and volunteers in U.S. regional offices and inside Syria. This was not possible without the trust and support from individual donors and volunteers from SAMS members and friends who believed in the mission of SAMS. The challenges, however, remain great. and the Syrians are in dire need for help and support. Join us in our mission to help save more lives.